This is a 22-year-old male adult patient with history of discharge from the umbilicus. So discharge is coming from the umbilicus and he has taken the medicine but still discharge is coming. So I have placed the probe at the umbilical region and here we can appreciate this tubular structure that is extending from the umbilical. This is umbilical tissue and extended downward and in the midline, and then it is going in the midline toward the pelvic region, maybe reaching the urinary bladder. This one. So what is this tubular structure? Whether it is a urachal sinus, whether it is patent urachus or any other urachal anomaly or fistula between the umbilicus and the gut loops. Let's analyze this pathology one by one and step by step. Do stay with me until the end of this video. Until the end of this video. Dear police, I am Dr. Sultan Ayub, working as a radiologist. Bismillahirrahmanirrahim. Iyaka na'budu wa iyaka nasta'in. Allahumma salli ala Muhammadin wa ala ali Muhammadin wa barik sallim wa sallim alayhi. Now, what is the urachal anomaly? First, we will talk about the urachus. It is related to the allantois in the fetal life. In the fetal life, what happened? The urinary bladder developed from the urogenital sinus of the cloaca. The urogenital sinus is the anterior portion of the cloaca. So after development in the early fetal life, the urinary bladder descends into the pelvic region, and as it enlarges and descends, the connection is established between the umbilicus and the urinary bladder, that is called urachus. After birth, this urachus, which is the connection between the umbilicus and the urinary bladder, obliterates. It becomes fibrous, and this fibrous structure is called median umbilical ligament. So it obliterates, become closed, and then it is called median umbilical ligament. And this remain closed up to the old age and does not open until it is patent or it is infected or there is obstruction to this pathway. It remains closed. So what we learn from here, normally in the fetal life, urachus, which is a patent, is present between the urinary bladder and umbilicus. So after the birth, this urachus obliterate, closed, and then become the median umbilical ligament. So now this 22-year-old fellow remains symptomless up to the age of 22 years. So 15 years ago, he developed the discharge coming from the umbilical. So now we are going to demonstrate this pathway what is likely the diagnosis. So I have placed the probe at the umbilical region with a high frequency probe, and it is the probe is in longitudinal direction. So I am going to follow this one. As we know that this urachus, this is the pathway, this is the sinus which is coming from the umbilicus. This is the umbilicus tissue, and this urachus lies between the fascia transversalis anteriorly, and posteriorly is the parietal peritoneum. So it runs in the anterior abdominal wall between the fascia transversalis and the parietal peritoneum. So now I have placed the probe in the midline at the umbilical region, and then I am going downward following this sinus tract. We can appreciate here this track is coming. I am also moving downward, dragging the probe downward. So it may be disappear, but don't worry. Inshallah, we will locate the pathology this fellow is facing. So this is the track coming. This again I am following this track. This is the track coming. This is coming. This is the track. This is the track coming here. This is coming. Now I have reached close to the urinary bladder. This is the urinary bladder. So I have reached close to the urinary bladder. Let's start from the urinary bladder, because here I'm feeling difficulty. So start from the urinary bladder. For this congenital anomaly, the urinary bladder should be adequately filled. So I have now placed the probe in the pelvic region. So here we can appreciate this tract, this black area, and it is, look at here, it is connecting with the urinary bladder. This is the apex of the urinary bladder. I have placed the probe in transverse direction, and this is the area which is connecting or which is touching the apex of the apex, which is present at the dome of the diaphragm, dome of the urinary bladder. It is touching this area. We can easily appreciate. So this is the transverse plane. I am now going to see it in the longitudinal plane, sagittal direction. So here I have placed the probe in sagittal direction, and look at this. If we closely observe, although this track is touching the dome of the diaphragm, but I cannot find any communication between the urinary bladder and this sinus tract. Otherwise, there should be transport or exchange of fluid from here to here, from urinary bladder to sinus, or sinus to urinary bladder. So where the pressure would be increase. If the bladder is having more pressure, it will transport the fluid into this tract, and if the pressure in the sinus is more, it will transport into the uribladder. So obviously the pressure in the uribladder is more, but we cannot appreciate this is the connecting point, but we cannot feel the any communication between the uribladder and this sinus. So now when we see, this is the sinus, this one, and this is the wall of the sinus which is thick. So let's, what is the, this is the, that ligament we can call it median umbilical ligament, which is having this sinus tract. So let's have a color. What is the Doppler of this? We can appreciate the blood flow at the wall of the tract. This here, so blood flow is present. I have set the Doppler with very low PRF at 4.4 and the color gain is at 35. So we have seen that the blood flow is present in the wall of this tract. So I am now following this tract from the urinary bladder toward the umbilicus. Look here. I am moving upward and look at the, this is the, so in longitudinal direction is difficult to follow. I am now placed the probe in transverse direction to follow this. Look at the walls are thick and this is the sinus tract, the white one in between, and now I am following. It has gone deeper, and this is the pathway. This is the pathway. So it has been compressed due to the probe pressure. Otherwise, this is present here. This is here. It is some uh, very small in size, difficult to follow. I am following this one and this. So this is coming here. We can appreciate this one. Sometimes it is disappeared, however, it is present, and this is present here. This one is. So this is the tract that is going into the umbilicus tissue. Again, we can appreciate this one, this one, this one, this one, this one, and this is the bladder. Here it has reached with no communication between the. So what we have learned that this is likely the urachal sinus. What is the urachal sinus? That which has the open end from the umbilical side, while it has closed end from the bladder side. So here it is a closed while it is open at the umbilical side. From here it is giving the discharge. So this sinus may be due to the infection, as we have seen the blood flow. This is producing the discharge. So this was likely suggestive of the urachal sinus, not patent urachus. And other anomaly may be the urachal cyst, in which the in midline cystic structure is present. Cyst is present while the umbilical and bladder ends are closed. But it is not the patent urachus, not the urachal cyst, and it is a urachal sinus. And this urachal sinus may appear late in the ages, as this fellow is having 22-year age. Now, this was all about the urachal sinus that is infected. One my message, we can say take home message, that the congenital anomaly doesn't mean that it will be present, it will give symptoms at the birth or after the birth. It may remain, this congenital anomaly may remain symptomless. This may not produce symptoms in the later life. In any time during the life, this may produce the symptoms, but if it is symptomless, it doesn't mean that it is not congenital. So this fellow was quite fit up to the age of 22 years, and this congenital anomaly then gave symptom at the age of 22 years. So congenital anomaly doesn't mean that it will give symptoms soon after the birth. It can give symptoms at any time during the later age. Thank you very much. I have asked the patient to urinate, to have an empty unibladder. What would be the behavior of this sinus after the urination? So this is the tract from the umbilical side. This is the umbilicus tissue, and this is the tract. And this is the urinary bladder, and here is the tract. This one, I have placed the probe in transfer direction of the pelvic region, and then this tract is entering, connecting with this is the dome of the diaphragm, connecting here. And this is the tract. This one we can appreciate here. This one, this is going, and this is the apex of the unibladder at the dome of the diaphragm. Here it is connecting with the apex. However, there is no communication between the urinary bladder and this tract, sinus tract. So the final diagnosis is the urachal sinus which get infected. This is the tract, and this is the connecting place at the apex of the urinary bladder. and this is the umbilical tissue, and from where this tract is coming. So as the tract is present, and we have seen the pathway of the tract, that is from the umbilicus to the urinary bladder. So no other differential we can say as the ampholitis, because in ampholitis discharge may come, but now we have seen the sinus tract, so our diagnosis is established, that is the urachal sinus. This is the bladder end, this one is the, and this is the umbilical end. And another, so the urachal anomaly are, I have already told you. Number one, patent urachus, which is not here. Then is the urachal cyst, in which the umbilical and the bladder ends are closed, while the cystic area is present. Cystic area is present in between these, while the other is the urachal sinus, which this patient is having, and fourth one is the vesico-urachal diverticula, in which the umbilical end is closed while the bladder end is open, and here is the diverticulum at this area at the apex, but here no diverticulum is present and no communication, so the vesico-urachal diverticulum is also not the case. So again, I am going to show you. This is the bladder end of the urachal sinus. This is the bladder, and this is the apex, and this is the sinus, and this is the umbilical end, and this is the sinus from the umbilical side. So open, this sinus is open from the umbilical side, and it is closed from the bladder side. Thank you very much.